Welcome back, everyone. I'm Rebecca Gomez. March is Skin Awareness Month, reminding us that skincare is more than just looking good. It's keeping skin healthy, and statistics say we're failing to recognize the importance of that. According to the Skin Cancer Foundation, skin cancer is one of the most common forms of cancer in the United States, though most of us don't know it. We've been talking with dermatologist Dr. Bruce Katz about ways to improve our skin, but what about preventing damage to our skin before it occurs, and equally important, learning to recognize potentially deadly skin problems that we may already have. Now, Dr. Katz, skin awareness, as I said, not just about looking good, it's also about detection in prevention as well. Many people don't realize they have skin cancer. Why is that?
Well, as you know, this month, March, is Skin Awareness Month.
Right.
And we're trying to get the word out to everyone to check their skin regularly, because often it's hard to tell if a mole has changed, if a sore that's not healing, that may be an early skin cancer, in fact. So the important thing is to check your skin on a regular basis, and also have your dermatologist check it once a year, just if you're not certain about changes.
For example, you could develop it on your back, not realize. Men on their chest if they have hairy chests, even on the scalp, you said.
That's correct. And there are good ways of just looking at the skin, examining it with a mirror, standing in front of a full-length mirror. And once a month, like women do breast examinations, everyone should check their skin in the same way.
Now, is the sun the primary cause of skin cancer, correct?
There's no question about it. There are 3 types of skin cancer, and the scientific studies show that the sun has been implicated in the cause of all 3 types of skin cancer.
And yet people still like to sunbathe. They're
That's
not
right.
getting the message, you think, huh?
Well, we're trying to get the message out, but skin cancer has risen dramatically. It's an epidemic, and it can be deadly in certain instances too. And people just go out in the sun and don't protect themselves, and that's really asking for a lot of trouble in the future.
Right. Now, there are 3 types of skin cancer. Can you briefly explain each one for us?
Well, I have a little chart here that shows you what some of these look like. One type of skin cancer is called a basal cell carcinoma. Another type is squamous cell carcinoma. And the third and most deadly one is malignant melanoma. And they're usually easily detected if you look at some of the different characteristics that we consider danger signs.
Right. In fact, you have what's called, or what you call, the ABCs of detecting whether folks in fact have skin cancer. Let's go over those now. Asymmetric mole, border irregularity, color and diameter. Explain each of those for us. Let's start with asymmetric mole.
Well, an asymmetric mole is, if you look at the mole, one half doesn't look quite like the other half. And that's what we call asymmetric. The border irregularity, if you look closely, the border may be jagged or scalloped and may be vague and not really clearly defined.
Okay.
If the color is unusual, if it's not one color, it may be shades of black, tan, red, or blue, that's another warning sign. And diameter being any type of mole that's over the size really of a pencil eraser, about 6 millimeters. All those characteristics tell you that a certain growth or mole on your skin may be an early skin cancer.
Now, for example, if someone already has a mole, can that develop into a cancer? They think, well, I've had this mole for a long time, but it's just changed shape or color.
Well, that's a very important point. If a mole that you've had for a long time changes in any way, it should be checked. And any of those characteristics changed, it becomes irregular, or the color changes, you should have your dermatologist evaluate it.
Okay, look for those ABCs then. How are cancers removed then if someone does in fact have one?
There are a number of different ways of removing them, but they can be cut out surgically. We can use what's called electrodesiccation, where an electric current destroys the cancer. There are a variety of different techniques that are used, but the important thing is to be sure that it's removed completely.
Now, we've done many shows on lasers helping with so many types of surgeries. Does it help in this instance as well?
Well, we get that question asked very regularly at our Laser and Skin Aesthetics Center here in New York. We don't really use laser surgery to take out skin cancers. We use it to help prevent skin cancer, to take away sun-damaged skin, any types of precancerous cells. Laser resurfacing does a great job at improving that, and at the same time, it takes away the wrinkles and dark spots
A little
as well.
benefit there as well. Well, we have a number we want to put up for people so they can get some free skin health information. There it is, 1-800-73-SKIN. So the final advice, Doctor, I'd gather, is stay out of the sun.
Absolutely. It's really important to be careful in the sun, and calling that 800 number will be very helpful in terms of reaching a dermatologist in your area.
Thank you, Dr. Bruce Katz, for your information. And that's it for Fox on Health for today. I'm Rebecca Gomez.